Hey, Gary Bird with SMC. We got a tip for you today that I think will help you with building your marketing campaigns. See, before a patient comes in, you need to identify how that patient is going to travel through your office. If you try to force them down a wrong path or down an avenue that they don't want to travel, this will actually prevent you from being successful with your marketing campaign. So this is really, really important when it comes to setting up your campaigns. I'll make it really simple and just say this. There's really three main ways that patients travel into your office. Number one is through hygiene. Number two is through the doctor's schedule. And number three is through a consultation. Let's go through each of these and see which one would suit you best for the kind of patients that you're trying to get. Okay, let's start with hygiene. So hygiene is great for driving in patients because, let's be honest, dentistry's done an amazing job at educating patients that patients need to have their teeth cleaned every 6 months. That preventative maintenance and just really beating that drum over and over and over again is awesome, and patients know it, and they're going to come back if you train them to come back to your office. So getting that new patient to come through that model or through that funnel is a great approach. It really does help with bread and butter dentistry. It really does help with getting that flipping treatment over to your dentist, especially same-day treatment, and all of that is awesome. Here's the downside to the hygiene though. Most people have capacity issues. And so if you're trying to get marketing new patients to come into your office when you don't have availability, it just doesn't work. It won't work. So you have to go in and you have to ask yourself this question. And this is what we ask all of our clients when they ask for hygiene patients. What is your availability? How long would it take to get a hygiene patient into your office? You really need a 48-hour window of time that you can get them in. That's the rule. If you start pushing out 72 hours or 4 days or 5 days out, your no-show rate's going to shoot through the roof, and you're really shooting yourself in the foot and destroying your return on investment and your opportunities. So you want to make sure that you have the capacity available for patients to have the flexibility to come in within that 48-hour window. That's the key with hygiene. Now let's look at the doctor schedule. The doctor schedule is really more for emergency patients or patients that have chipped their tooth and they got to get it fixed, or something that's urgent that they have to get in for. Now, these patients are great because it's almost always instant treatment, right? It comes right in the doctor's schedule. Doesn't matter if your hygiene department's packed or not, we're gonna get those patients in and you're gonna be able to treat them right away. What's the downside? The downside is typically with these emergency patients, there's a reason that they're coming to you, and it's usually because they haven't listened to the dentist in the past, right? So these patients are usually uninsured, usually don't have a dental home. And again, I look at that as a great opportunity. Key here is to make sure that you get them back into your hygiene and that they're repeating and coming back through that hygiene department. So that way you're not just spending that money on the marketing, getting a little treatment and never seeing that patient again. There's several different ways to do that. Obviously, in-house memberships is huge for this. Also, positioning your hygiene so that the uninsured patients aren't paying a really high amount for their second visit. That I've seen that with a lot of practices that kind of scare away the patients. They do some kind of aggressive pricing for the first visit, but the second visit's really high, and really those patients are never going to come back. So having that plan in place, how that patient is going to move through your office is really, really important if you want those kind of patients. The last area is consultations. Consultations are usually going to be for larger treatment, and they're almost always free consultation. These are going to be for your Invisalign patients. These are going to be for your implant patients. These are going to be for patients that have questions but don't necessarily want to get x-rays and don't want to commit yet, but they do want to start building that relationship. The consultation is how you're going to want to drive that in. You don't want to drive that patient through hygiene, though you may drive some through hygiene and get it from there. That's not the main way to get that patient in. And you don't want to drive them in through the exam and x-ray and make them go through that process if you haven't built up the trust yet, because there's much more trust involved with getting these patients to accept treatment. So those are the three main ways that you can drive patients through your office. So I challenge you, when you go to set up your marketing campaign, ask yourself, how is this patient going to come through this office? And are we positioning them in the place that they want to be? And are they coming through and get the service that they actually want? Thanks. Have a great day.